had to be landscape. Okay, sorry about that. So, hey guys, I'm sharing to lateral epicondylitis. So, let's break it down. If you are dealing with lateral epicondylitis, also called tennis elbow, one, super common, super common. You don't have to be a tennis player to be dealing with this. In fact, it's more common and more prevalent in everyday people, everyday users, over irritating and overusing these small tendons that attach right here on your elbow. Okay, so if you look at the side of your elbow, there's a bony prominence right here called the lateral epicondyle. And if you follow this down, watch as I start using my fingers. Okay, I'm wiggling my fingers. Those muscles and tendons are firing. So my wrist fingers is depicting how much this muscle is being used. Okay, so in my experience, most with this problem, computer desk workers, right? Okay, office jobs. But of course, if you have any high repetitive wrist hand movement activity, job, or something you're spending hours a day doing, add that up over the course of a week, months, years. If these muscles aren't strong and they're deconditioned or overworked or overused, they're going to flare up and fire, basically get inflamed. Okay, so tendinitis is truly by definition inflammation of the tendons. Tendons are the connective tissue where the meaty part of the muscle then turn into connective tissue to attach onto a bone. All right, so tendinosis is a little more long-standing degeneration to that tendon. So you see a little more microscopic tearing, more breakdown, the duration, the time of the symptoms compared to more acute symptoms, okay? That may be a few weeks, a few months. Tendinosis is definitely in the few months and more. Sometimes people deal with it for a year. So again, just so you get an idea, use your hands, figure that out, kind of notice what you're doing with your hands and fingers. Now, if your hand's in an extended pose like this, say on a keyboard or typing or using a mouse for prolonged hours, now those muscles are even more taut, even more contracted. So more pull and tensile force on that bone. And basically over time, when that pulls on the bone, you create inflammation and swelling of the tendon. The bone itself can be quite tender. If you ever hit it, it'll be super tender to the touch. Other symptoms are aching pain throughout the forearm. Oftentimes it's right here on that bone, but it can extend down the arm as well, these symptoms, as it would follow the pain pathway of the nerve that goes through those muscles and innervates those muscles. It would hurt to grip and squeeze. Okay, so if you're simply holding a child a lot more because you just had a baby, if you're doing weightlifting, okay, and you have ramped up in a not so progressive way, increased your weight, if you're doing just a huge change in your weight regimen, and again, you're gripping more free weights, more discomfort, a push-up, any loaded position where those tendons are on fire. Okay, so you got an idea of some of the symptoms, location pain, some of the triggers. I want to give you some quick exercises to do. So the best way to catch these injuries is early on. Start noticing the discomfort of the elbow. You get kind of Google and you start discovering what it could be. And you Google and you find lateral epicondylitis or tennis elbow. And if you haven't caught on, tennis is where it's gotten its coin turned, because in tennis players there's a lot of wrist extension, of course, backhand. There's a lot of force impact to the ball and the motion itself of the you're gripping a racket. Let's move on to these exercises. So if you've started noticing it right away, let me give you some stretches you should be doing. Now, if you're stretching, extend the elbow, getting it fully elongated. Your fingertips are, because these tendons extend to the knuckles, so you're going to be bending all the way through the arm. And I'm going to kind of lock my elbow out here. If this is too intense, you can come lower. You can lessen the amount of pressure you're pushing on, but stay here for 30 seconds, okay? You can turn it in and kind of clasp the hand and pull. You can point down, as long as you're feeling that pull. And it's not comfortable, but you want to get an intense stretch. Try to hold it if possible, 30 seconds long. Do that 3 times in a row. Do both sides if possible, okay? Even if you're not symptomatic on this side, don't ignore it. Give it some attention, because more than likely, because this one's hurting, you're going to start using this side a little more, And in fact, if it's really acute and you can't use it at all, you should be mousing on this arm a little while, alternate arms, that's great. Start picking groceries up or things on the other side. Well, that being said, if this is your dominant arm, it's more than likely stronger. You can start developing symptoms on this side. So rule of thumb, I always go with do both sides. Train both equally. They eventually even out. So extending stretches, right? Extension stretches. Now the trick with that is not just the 3 times in the row. It's that you're doing it 3 to 5 times a day, okay? 3 to 5 times a day throughout the day, morning, noon, and night, or more, right? So if you're maybe stopped at a light, okay, not driving your vehicle, go over your steering wheel and put that stretch into play. Whatever you can remember as a trigger to do it. Wear a wristband or something, rubber band, so you remember that side, and then go to the next afterward. All right, so after you've done your stretches, frequently, I'm going to give you something that's a massage technique to try as well, but this is much less frequent, once a day, maybe even every other day. It's called cross friction massage, and you're going to find and locate with your fingertips that point of pain, okay? Get in there, right where it hurts, and then you're going to press downward, up and down, cross frictional massage across that tendon. So I'm going up and down across the length of the tendon. Remember, they go lengthwise here, pressing up and down. Maybe do this for a minute or 2. You are going to have pain with this. Make sure it's tolerable, but know that it's going to be desensitized over time. Okay, so cross-friction massage, much like trigger point massage, helps decrease the intensity of the pain, and those neuroreceptors that are telling your brain of that pain, you'll desensitize some of that. You're also going to promote healing. You're drawing blood into that area and encouraging healing and growth from that blood flow. I wouldn't recommend doing that, prior to having to use your arm, or it's gonna be a little sore afterward. Again, skip a day and then do it again, and let that healing, that blood flow to the area help. So don't apply ice right afterward either, but ice is a great idea to apply to that site once or twice a day as well, okay? There's a nerve that passes right through here, so kind of be gentle with that. Maybe put a paper towel down and then put your gel pack so you don't get any chemical burns or irritate that, your funny bone, right? The ulnar nerve that passes right by that bone. Now, when it comes to strengthening, again, these are intended, these are for some acute traumatic event, tear, you go see your doctor, make sure your PT is involved here. But if you're in a subacute stage and you've done what I said and your symptoms have subsided for a few weeks and you've done the stretches, you've kicked it in the butt, great. But now the trick is to keep them strong so that it doesn't flare up again, because more than likely your behaviors are going to keep going. You're going to keep your workouts, you've modified your activity for a while, you've started using the other side, you've done less gripping exercises and activities. Then you can begin some of these strengthening exercises. The first one I'm going to show you, I would start with first, and these are eccentrics. Okay, so I'm going to give you a little view here off the edge of the table. Immense gravity all the way up. I'm going to apply downward pressure with this hand, resist, and slowly allow it to bend. So I'm pressing down firmly here, maybe 50% of my strength, but I'm only letting go, releasing it slowly. So these muscles are firing in an elongating method where it's stretching and contracting at the same time. Come up without pressure, apply that pressure, and then slowly let off pressure as you release downward toward all the way through flexion. This should take about 6 to 8 seconds to get all the way down. Release pressure, come up and repeat 10 times, maybe 2 sets. This should be a very subtle soreness maybe, but not painful. Okay, you're applying too much pressure if it is. An alternative to your hand being the resistance, you can use resisted bands and such. I'm going to hold it down below with this hand. Okay, I'm starting high without tension, pulling down but slowly letting it give. Okay, so it's this elongating eccentric load that you're applying to the wrist. Okay, and then repeating that. Now you can also do that with free weights and dumbbells, but if you're holding a weight, pick a couple pounds, don't go crazy in the beginning, help it on the way up, and then hold the weight to slowly lower down. So your focus is the downward phase, not the upward phase. Sorry about that, lost signal. Anything top heavy, and slowly rotate your top heavy weight from side to side. exercises that involve wrist movement, isometrics. Try to keep your wrist neutral in the majority of those exercises though. There are weight objects that you can grip and do some grip strength with too. Just avoid that in the beginning. Don't be symptomatic when you start into some gripping exercises, as of course we just mentioned, that's a trigger. But your grip strength and your ability to resist and have a strong grip is really imperative at some point to building your strength and resistance to this injury from reoccurring, okay? But it's not just as simple as a grip ball. You want to involve exercises that strengthen your wrists as well. People use sandbags and such, and they're gripping and lifting and using weight like that. So go inside of a bed of sand or rice and move your hands around, strengthens your wrists and hands. It's a great therapeutic exercise. Lots of ideas out there. But in the meantime, until it gets to that point, rest. Number one, rest. Ice. Do your stretches. Do some cross-friction massage. As it settles down, start some eccentric strengthening, number one first, okay? Not concentric. The more you do a weight lifts and wrist extension, you're just going to irritate that tendon, and that muscle is going to flare up again. All right? Thanks for coming on today. If you have any questions, you can message me through this. You can find me on Instagram at Jacqueline Rose AZ Life. All right? Take care. And talk to you later. You can also email me at my business email, jacquelinerose@gmail.com. Sorry, JacquelineRoseRojas@gmail.com. All right, take care. Thank you.